So last year, I put on my Facebook page that I was going to get my mammogram and that I had not received a mammogram in a couple of years. So I decided this year to do something a little different as I get my mammogram this year. So a couple of questions I'll have for you if you don't mind ask questions. So the first question is, why do we have to get a mammogram every single year? I mean, if we're going to do the self-breast exams every month, then why is an annual mammogram required?
We recommend on a regular basis that women do a self-breast exam, especially since you're only seeing your provider maybe 1 month out of the year. Those other 11 months, something could show up in your breast that didn't show up previously. You may have a mammogram done earlier in the year, and unfortunately, maybe if something didn't get picked up, it was too small, the changes were not noticeable on the first mammogram, and that it shows up at a later date. So you want to do it on an annual basis, just in case some changes show that didn't show on the last exam. But
one of the things I've heard, and tell me if this is true, because it just may be something I've heard, is that when a woman is younger and she is diagnosed with breast cancer, the cancer is much more aggressive. Is that true? And if so, why is that true?
Well, a lot of times when younger women get it, it's usually maybe related to hereditary, even though when you look at genetic risk factors, it's maybe about 10 to 15% of breast cancers. Women who get it younger usually have a genetic basis for it. You may have heard about the BRCA1, BRCA2 genes. Those are associated with those, and that they're more aggressive. So those women are more at risk. And so in the case of a genetic predisposition to it, you want to catch that as early as you can. And those cancers tend to be much more aggressive.
Oh, wow. And I did do some research, and this was pretty disturbing to me. And I found out that women of color, especially Black women, have a much higher rate of dying from breast cancer. Even though they may be diagnosed at the same rates, they may die, we do die faster. I'm confused by that.
Sometimes it's a mere fact of the statistics in terms of risk. Black women tend to go and get things later. They tend to go to their providers later. So at the stage in which you catch it at may be at a later stage. And so those cancers will be picked up later, much more aggressive, much more chance of being metastatic. So in that case, that affects our mortality, the ability, access to care, and even going later for care.
So if you're diagnosed later in the stages of breast cancer, you're less likely to recover.
Right, and because your stage may have a more aggressive cancer, and your stage may be higher.
Oh gosh. Okay. What do we do for women who don't have the money and may not feel like they don't have the insurance and may not feel like they have the money to get their mammograms done regularly? What happens then?
Inova Healthcare has a big breast cancer center. They do a lot of help. They reach out to families. CDC has a website. They have a website out there for National Prevention for Cervical and Breast Cancer. So they've got some recommendations for places in the area. The American Cancer Foundation has something. We have Tiger Lily Foundation. We have different resources that are out there. So we don't want women not to get it done because of resources, but to be able to handle and talk with their providers to see if we can give them some recommendations.
Last question. So some people say that they're painful, right? Getting the breast exam is painful. Getting the mammogram is painful. No one wants to be in pain, right? So no one wants to be in pain. Right. So are they painful? What does that look like? What's the procedure? And then after you complete your breast exam or your mammogram, how long before you get the results?
I think it can be a deterrent for some women who are fearful about the pain because they hear different things from their friends. People hear, oh my gosh, you're gonna smash them to death. I don't have but a little bit of breast. That's gonna hurt. I know that's gonna hurt. I don't have much breast. And then the people who think they got a lot more breasts are concerned too. But there is an issue for some women about breast tenderness. But what I would say to those women is, look at what time you schedule it. You want to try to, best time to schedule it is after your cycle, because there are women who have dense breasts, which means their breasts are much more fuller. Sometimes it's harder to get really good view sometimes of the breast. But those women also sometimes may have fibrocystic breasts. Women that have fibrocystic breasts have tiny little cysts that are fluid filled. So those women are much more prone to have some tenderness and some discomfort in general
Okay.
for whether they're having a mammogram or not about a week before their cycle. So those women, I would say to them, be careful when you schedule it, try to schedule it after your cycle. And then what's going to happen is basically once you go in, they're going to position your breast on the machine. They're gonna do different views, and then usually after that, provided they don't have to do any additional views or they don't find any findings, is what will happen is we will get information maybe about 24 to 48 hours. Now, if they see something on that mammogram right then and there, usually I'm gonna get a call within the hour after that person has had that scheduled, because sometimes they will allow them to leave and then call back to reschedule some additional views or biopsies, and then the patient may have their hard copy probably in about a week, but I'll have something probably in about 48 hours.
That's a very fast turnaround.
Yeah.
That's a very fast turnaround.
Usually pretty good.
Yeah, faster than I realized actually. Well, doctor, thank you so much for sitting down with me today and having this conversation. I really, really do appreciate it. I appreciate you. It's just such an important moment.
It absolutely
and of course, October is Breast Cancer Awareness Month. And so for us to be talking about this month and encouraging women to get their breast exam. Now, I do think that there's some information I can have about how to do my own self-breast exam. Is that right?
So what I normally try to pass out to patients is just a little flyer, something that remind them that they can put in the shower, just as a reminder, even though we're recommending and doing it every month. People can forget that. So it's just like a reminder. Okay. But it has some good information on it as well.
And it has a little cutout so you can do it every month.
A punch out for each month.
Yeah, this is what
going to hang in the shower.
Okay.
Yeah.
Wonderful.
Absolutely.
Wonderful. Yeah. Cannot thank you enough for doing this with me. Thanks so much.
It's good to see you.
And you'll see me.
Look forward to seeing you next year.
Next year. Yes. We'll not miss it. Thank you.
Thank you.
Good morning. Thank you. Thank you. Thank you. Thank you. Thank you, Keisha. I appreciate it.
Thank you so much.
Hi. How are you? Good. I'll take that paperwork for you.
Thank you.
You're welcome. Come on back.
Thank you.
You're welcome. So, nothing concerning today, right? Good. And no deodorant.
No deodorant.
Perfect.
No deodorant, no
Good.
perfume, no lotion.
Very good.
We're good.
All right, you can come on in the first dressing room here.
Okay.
I'm going to grab you a gown.
Okay.
So just waist up off,
Okay.
opening in the front.
Okay.
You can leave your necklaces on. I just usually turn them around.
All right.
Okay.
All right. Thank you.
You're welcome.
So they told me not to wear any deodorant, any lotions, any perfumes, and I haven't. But tell me why. Tell me why I can't.
Some deodorants and lotions can have aluminum in it. So it will show up on the image and we'll have to repeat it. We'll have to wipe down and repeat. It shows up as an artifact.
Oh, and you do not want to do that.
No,
You don't want to do that. Okay, thanks.
Mm-hmm.
So Katie, this is not my first mammogram. I've had one before. And of course, when I've had one, I realized that there is a lot of manipulating and touching of the breast for the purpose of positioning. For some women, that's uncomfortable to have someone touching the breast and positioning the breast. Why is that necessary?
So we have to maximize the amount of tissue that's visualized. In order to do that, we have to kind of pull and tug to make sure that the image doesn't have any folds, creases, anything like that, and we're not missing any tissue towards their chest wall. So the reason we're close together is because we have to maximize the amount of tissue that's visualized.
Okay, all right, thank you.
Mm-hmm.
So Katie, my last question is, how long does the actual procedure take? So I've done all the meeting with the doctor and all those types of things, but the procedure itself, how long should that take?
It usually takes about 15 minutes. We have to get a history on you, make sure nothing needs updating, family history, all that kind of stuff. The actual imaging itself is really very quick. We only take 4 pictures and it goes by really fast.